So what is malaria? The female Anopheles mosquito is a vector of Plasmodium protozoan parasite. There are 5 Plasmodium species that cause malaria, which is Plasmodium falciparum, Plasmodium vivax, Plasmodium ovale, Plasmodium malariae, Plasmodium knowlesi. However, the most common ones are Plasmodium falciparum and Plasmodium vivax. In 2015, 91 countries and areas had ongoing malaria transmission. Estimated 3.2 billion people in 95 countries and territories are at risk of being infected with malaria, while 1.2 billion are at high risk of getting malaria. Hence, nearly half of the world's population was at risk of malaria. Malaria cases are often found in warmer regions of the world, such as tropical and subtropical countries. Most malaria cases and deaths occur in sub-Saharan Africa, while Southeast Asia, Latin America, and the Middle East are also at risk of getting infected with malaria, and this will cause a drain on many national economies. Infants, pregnant women, children under the age of 5, immunocompromised patients, and non-immune travelers. Malaria, as reported by WHO and CDC, 212 million cases of malaria in 2015 and 429,000 deaths. In 2015, 91 countries and areas had ongoing malaria transmission. Between 2010 and 2015, malaria incidences among populations at risk fell by 21% globally. The mortality rates among populations at risk fell by 29% globally among all age groups, and 35% of them were children under the age of 5. In 2015, the African region was home to 90% of malaria cases and 92% of malaria deaths. It was estimated that 6.8 million malaria deaths have been averted globally since 2001. The life cycle begins when the malaria-infected female Anopheles mosquito takes the blood meal and inoculates sporozoites into the human host. The sporozoites then infect the liver cells. In infected liver cells, the sporozoites mature into schizoid. The schizoid will then rupture, releasing merozoites to the human bloodstream. And this whole development of sporozoites in the liver cells are known as exoerythrocytic cycle. The merozoites released to the bloodstream will then infect the red blood cells. The merozoite will then form a ring-stage trophozoite in the red blood cell. The ring-stage trophozoites matures into schizoid, which then rupture, releasing merozoites. The whole process of parasite maturation in red blood cell is known as erythrocytic cycle. Some parasite present in the bloodstream, which is the merozoite, will then differentiate into gametocyte. The microgametocyte, which is the male, and macrogametocyte, which is the female, are ingested by the Anopheles mosquito during the blood meal. In the mosquito's stomach, the male and female undergo sexual reproduction, generating zygote. The zygote will then become motile and elongates, forming ookinete. The ookinete will next develop into oocysts. The oocysts grow and then rupture, releasing sporozoites, which make their way to the mosquito's salivary gland. The inoculation of these sporozoites into a new human host completes the whole malaria life cycle. And the whole cycle occurring in the mosquito's internal body are known as the sporogonic cycle. The signs and symptoms of malaria typically develop within 10 days to 4 weeks following the infection. Some people may not develop symptoms for several months. Or some malaria parasite remains dormant for a long period of time in human body. The common signs and symptoms of malaria includes
shaking chills, high fever, profuse sweating, headache, nausea, vomiting, diarrhea, anemia, muscle pain, convulsions, coma, and lastly bloody stool.
Microscopy examination. Malaria parasites are detected by examination of patient thin blood smear. Malaria rapid diagnostic test to detect malaria antigen presence in patient blood. Malaria can be treated by artemisinin-based combination therapy (ACT). It's recommended by WHO to treat uncomplicated malaria. ACT is artemisinin combined with a partner drug. It reduces the number of parasites within the first 3 days while the partner drugs eliminate the rest. Since malaria is spread by mosquitoes, anything that prevents mosquito bites can help, such as full body clothing. Sleep in insecticide-covered mosquito nets. Use insecticide spray or mosquito repellent. Anti-malaria drugs will be given to pregnant women or travelers as prophylaxis to prevent malaria before they contract the disease. In addition, Anopheles mosquitoes like to lay their eggs in small, shallow collection of fresh water. Hence, in order to control the mosquito population, it's important to empty container with water and any other stagnant collection of water. Research is ongoing to develop safe and effective vaccine for malaria. The development of an effective malaria vaccine poses major challenges as a comprehensive vaccine will need to be effective against a number of strains of malaria parasites. The malaria parasite has the ability to evade your immune system by constantly changing its surface antigen. So, developing a vaccine against these varying surfaces is very difficult. The only approved vaccine as of 2015 is RTSS.
As a conclusion, malaria can be treated at early stages. However, fatal if it is untreated on time. Hence, prevention should be taken to reduce the likelihood of getting infected. Thank you.